Focusing on ADHD, an in-depth look at the disorder. Driving in young adults with attention deficit hyperactivity disorder, knowledge, performance, adverse outcomes, and the role of executive functioning. Past studies have shown that adults with ADHD tend to have a higher risk of driving problems, including more traffic citations, particularly for speeding, vehicle crashes, and license suspension than those without ADHD. Although previous studies have established this correlation, they did not attempt to determine the basis for this increased amount of driving problems. Although it is understood that ADHD causes serious deficits in cognitive functioning, it's not entirely known how these deficits adversely affect patients in different aspects of their lives. In order to analyze how ADHD can affect driving ability, the researchers broke down what components are involved in driving: basic cognitive abilities, operational abilities, strategic abilities, actual driving behavior and the use of safe driving practices, adverse driving outcomes. Perceptual and response interference in children with attention deficit hyperactivity disorder, and the effects of methylphenidate. Do children with ADHD get more distracted by irrelevant information and have a hard time focusing because they have difficulties integrating perceptions and producing responses? Does methylphenidate, i.e. Ritalin, help with these problems? Although it is the most frequently diagnosed psychiatric problem in children, the underlying mechanisms of ADHD are still widely unknown. Methylphenidate and its related compounds are used to successfully treat the symptoms of ADHD, although how it actually affects those with ADHD is not entirely understood. Attention deficit hyperactivity disorders, psychostimulants, and intolerance of childhood playfulness, a tragedy in the making? Over the past several decades, there has been a sharp increase in the number of ADHD diagnoses in children. Despite the fact that the physical mechanisms of the disorder are still not entirely understood. Are the doctors overdiagnosing ADHD because of an intolerance of childhood playfulness and changing societal expectations and structures? ADHD is the most commonly diagnosed psychiatric disorder in children, 8 to 10% worldwide. Although methylphenidate has been successful in treating ADHD symptoms, it is not known what adverse side effects its users will have in the future. Is the reason there are so many children with ADHD because it is actually such a widespread neurological problem? Or are doctors overdiagnosing children who are exhibiting normal childhood behaviors? Impulsive behavior in adults with attention deficit hyperactivity disorder. Characterization of attentional, motor, and cognitive impulsiveness. At least half of all children diagnosed with ADHD continue to show symptoms as adults. However, ADHD in adults is studied far less than in children. Impulsivity is one of the predominant symptoms of the disorder. The study was done to determine whether the three aspects of impulsivity, attentional impulsiveness, non-planning impulsiveness, and motor impulsiveness, remain in adults with ADHD. ADHD is the most common psychiatric disorder diagnosed in children, 8 to 12% of children worldwide, despite the fact that the underlying biological mechanisms of the disorder remain unclear. Although it is mainly considered a childhood disorder, evidence shows that at least half of all children with ADHD continue to show signs of impairment as adults, 3 to 5% of adults worldwide. ADHD in adults can cause patients to exhibit behaviors that can negatively impact their daily functioning, including antisocial behaviors, problems with their peers, occupational problems, vehicle accidents, and traffic violations. Studies have shown that impulsiveness persists in adults with ADHD. It has been suggested that this symptom might be the underlying cause of many problems faced by adults with ADHD. A trained neuropsychologist administered the test and was blind to the diagnosis being studied. To analyze the results of the test, a one-way ANOVA was used along with the Pearson coefficient analysis for correlations between measures obtained from the ADHD group. The Pearson X2 was used to test difference in dichotomous measures, gender distribution among groups. 50 participants were chosen from the research group on learning disabilities, attention and hyperactivity, 22 women and 28 men. Local advertisements recruited 51 control subjects, 31 women, and 20 men. To participate in the study, the individuals must have met the ADHD requirements of the DSM-IV and pass the evaluation by an independent psychiatrist and neurologist. They must have an education above the 8th grade level and be between 18 and 60 years old. Participants were excluded if they had a current psychiatric or substance abuse disorders. According to the DSM-IV, 14 participants were labeled as inattentive and 36 were labeled combined. The participants were given the Barrett Impulsivity Scale version 11, a 30-item self-evaluation test. It includes 3 subscales: non-planning impulsivity, orientation towards the present instead of the future, motor impulsivity, fast reactions and restlessness, attentional impulsivity, problems related to concentration. The participants also participated in the Continuous Performance Task 2, which measures sustained attention and impulsivity. They were asked to press the spacebar when any letter other than X appeared. An omission error occurs when the participant does not press the spacebar. A commission error occurs when the participant presses the spacebar when an X occurs on the screen. The subject showed a failure to inhibit a prepotent motor response. The participant also completed a computerized version of the Iowa gambling test. This task asks patients to complete 100 trials with 4 decks. Each turn will gain or lose them the money. 2 decks yield high money gain, but will incur high losses in the long run. 2 decks yields lower immediate wins, but less loss in the long run. Control subjects learn to avoid the higher loss decks and play more advantage ones. Impulsiveness can be defined as a process that includes a swift action without conscious judgment, a behavior without adequate thought, and a tendency to act with less forethought. The Raven Progressive Matrices measures for difference in age, intelligence, and gender and found no significant results, however. The Barrett Impulsiveness Scale found significant differences between those with ADHD and their control group in the intentional, motor, and non-planning scores. People with ADHD have less control over their ability to concentrate, maintain motor control, and plan for the present. There were also significant results on the continuous performance task. The ADHD group committed more errors by omission, not pressing the spacebar, and commission, pressing it at the wrong time. On the Iowa gambling task, the ADHD group chose more cards from the disadvantaged decks than the advantageous ones. There was also a correlation between the results of the CPT2 and the results from the attentional score on the BIS. Inattentiveness leads to mistakes. Overall, the ADHD group showed more signs of inattentiveness, impulsivity, restlessness, and lack of planning. The authors state that the results go beyond the use of self-report measures of motor and attentional impulsivity in order to gain a better understanding of the neurobiology of ADHD and its symptomology. The ADHD group did worse on the tests of omission, such as the continuous performance test that we discussed in class, and in this performance test, you do not hit the X in a stream of letters. This test was performed multiple times. The ADHD group did significantly worse than the control group on all of the trials. The data the authors accumulated supports the hypothesis that the deficits of ADHD are related to the 3 components that they were testing for, which are impulsivity, motor, cognitive, and attention, in regards to adults with ADHD. The ADHD group did not differ from the control group when it came to intelligence, which goes to show that the difference in the measures of impulsivity are not correlated to the difference in measures of cognition indicating generalized intelligence has nothing to do with ADHD. The authors did not find a correlation between measures of executive functioning using an Iowa gambling test and a continuous performance test, which tests for commissions of and omissions errors. Therefore, the results support the theory that there may be two facets of impulsivity. The findings of the study are consistent with the previous studies that report individuals with ADHD make disadvantageous choices compared to the control groups. The ADHD group also showed that lower scores in planning ability, which supports the hypothesis that cognitive impulsivity is a factor in adults with ADHD. The authors did a good job at interpreting the data. The questions they asked were conducive to finding a better understanding of the symptoms of ADHD. Although this study was very in-depth, the authors could have used a larger sample size. Overall, the study was well done and easy to interpret. Something they could do for a follow-up would be to use more diverse groups. They could have a separate group with dual diagnoses, one diagnosis being ADHD and a separate being another disorder, to see if there was any correlation in the symptoms of other disorders. Another follow-up could be to use a control group of people with ADHD and a separate group of people on ADHD medication using the same methods of testing for symptomology. In ways, this relates to studies about damage to the brain that causes people to lose attentional abilities. In studies of traumatic brain injuries, certain parts of the brain can be damaged, which can cause people to display similar symptoms to that of ADHD. Thus, studying both traumatic brain injuries and ADHD can give a better understanding of what part of the brain facilitates in specific attentional brain functions. Attention is a part of everyday life. Without it, people would not be able to perform tasks or keep long-term goals. Therefore, understanding attentional deficits can give better insights on how to treat those deficits and what causes them in the first place. Studies like this can also help show the different facets of ADHD and the severity levels of the different symptoms. Knowing about the different facets and symptoms can also help show what sort of problems people with ADHD face.